BC schools continue to record dozens of COVID-19 exposures on a daily basis, and now highly infectious variants of concern are assumed to be dominant in the province. With no indication of coming school closures, BC's education leaders want to see more action on speeding up vaccination plans for teachers, which they say are on pause.
There would be a delay for vaccinating those teachers and K-12 staff, and also essential workers.
In March, teachers along with other frontline workers were promised an early AstraZeneca shot, but that program was halted at the start of April because of concerns around the vaccine causing rare blood clots for people under the age of 55.
So we all knew that there was a pause and really no indication when that pause would actually change.
While teachers are still on the priority list, West Vancouver Teachers Association President Renee Willicks says the district has been waiting for more information since March break.
And we know that the variants of concern can have a devastating impact on younger people, including teens and young adults. Our teachers who can have taken advantage of the AstraZeneca vaccine if they're 55 plus, but most of our teachers are younger than that, and they are still waiting to hear about what is the plan for vaccinating them and whether the government will pivot on their current age-based rollout.
We've seen a pivot with vaccination strategy throughout. Like, we have seen hotspots being addressed. We know that Surrey teachers have been vaccinated. Or are being vaccinated. So we know that change is possible.
Meanwhile, in Ontario, 69 schools are closed because of COVID as of April 9th. Over a quarter of its 4,823 schools have reported COVID cases. On Friday, Dr. Bonnie Henry admitted that BC is about a month behind Ontario's spread of variants, but says she has no plans to follow Ontario's lead.
Sometimes having students at school, at least we can control things a little bit more. But that said, there is a time when if cases are becoming too high and there's not a way to vaccinate teachers, that we may have to shift stages and reduce density so that we can increase distance between people in the classroom.
Willick acknowledges that vaccine supply is the problem and has asked Vancouver Coastal Health about the possibility of reserving certain vaccines for teachers or even leftover doses.
We know that there is a plan for who's getting called to access those doses, and I can tell you it's not teachers. And we're not being told who is getting those leftover doses. But I'm advocating hard that it go to those who work in schools, because if we want to keep schools open for our students, we need to vaccinate the adults who work in those schools.
We reached out to Vancouver Coastal Health for an update on the worker vaccination program, but they said they don't have anything to add. In Vancouver, Kier Junos, City News.